So let's dive right in this morning. We begin with the 72nd governor of the Commonwealth of Virginia, Terry McAuliffe. The governor recently signed legislation aimed at improving access to mental health services across the state. Welcome to the governor, and joining him is Reed Wilson, the Hill's national correspondent. And I will just turn it over to Reed.
Morning, everybody. It's right here.
Here you go. Can you take that one?
Okay,
take this
great.
one. All right. Well, thank you all for being here. And Governor, thank you for being here as well. Thought we'd start off with the news of the day. The Affordable Care Act repeal is dead, at least for the moment. What should Congress do next?
What they ought to do, it's great news that it's dead. I thought for a while it was going to be dead. We spent the whole weekend, we had all the governors up in Rhode Island. It was clear in my conversation with Republican governors, everybody was very uncomfortable with it. You know, we got a presentation before Secretary Price came in and addressed us that showed all 50 states with dramatic losses of income, and literally millions of our citizens were losing coverage. So it didn't surprise me that it happened that the two senators came out yesterday. Now what they ought to do, it definitely needs to be fixed. There's no question about it. We need to make sure that, you know, the individuals continue to get the subsidies. The cost savings, we need to make sure that the health care plans are in, and the reinsurance needs to be financed. I mean, that's the most vulnerable citizens, the sickest individuals. Those three things need to be taken care of. And then we ought to do work on generic drugs. There are proposals that on the Medicare, once you get out of the hospital, the post-stay bundled services could save billions of dollars. There are so many things we could do to save money in health care. Bring the governors in. We run these programs. That's the point I made all along. You know, Congress is up, you know, passing all this legislation. What they do comes to our desk. We administer the Medicaid program in our states. We have a lot of best practices. Bring us in. Let us work together. Bring, you know, what best practices we do at the states and do it in a bipartisan way. I've been arguing about this. I've spoken to the Speaker. I've spoken to Leader McConnell. Let us come in. Let us sit at the table. Do it in a bipartisan way. The problem with health care is the uncertainty, and that's been the problem. And the insurance companies don't know what to charge. They're trying to do their rates for next year. The problem goes back to 2014. When it first came in, you know, there was no data on plans. We didn't know what the health of all the citizens were, how much it was going to cost. And they went in competition, and it was those insurance premiums that really put the program backwards financially. And then 15 premiums went up 2%, 16 they went up 7, not enough to cover 14. That's all behind us. Come together, sit at the table, and let's put together comprehensive health care reform. I'm very optimistic.
I thought it was remarkable that so many Republican governors specifically were so out front lobbying in this. Brian Sandoval in Nevada, John Kasich in Ohio. What were they telling you?
Well, and Brian and I are very good. I was chair of the governors, and he was my vice chair, so we worked very closely together. But, you know, we sat next to each other all weekend. You know, I got my report within an hour as soon as the bill came out, and it showed Virginia. Any Virginia residents here? Very smart people. Good. Okay. Very good. Maryland, D.C., Hal, you're paying those taxes over there? Come on, come across the Potomac River. Come on. In Virginia, it cost us $1.4 billion over 7 years. Brian got his report a couple hours later, and I was sitting next to him, and he had a sheet of paper in front of him, and he was looking at it and showed similar losses for Nevada. And as you know, Vice President Pence came up, and Secretary Price and Administrator Seema Verma, and he had to meet privately with them, the three of them, and they put the hardcore press. But he said, "Here's the sheet. Tell me where these numbers are wrong." And I met privately with the secretary. I said, listen, it's going to cost me $1.4 billion in Virginia. Tell me how these numbers are wrong. And they didn't have good answers. You know, their growth rates, you know, were very conservative. They said, well, you can make it up. We'll give you more authority in the states. We'll let you use more waiver authority. Well, as you know, waivers have to be revenue neutral. That doesn't save me any money. So it was all hocus pocus. And the Republican governors, I mean, the Medicaid expansion, we didn't. I'm sure we'll get into it, unfortunately. But for those 31 states that did the Medicaid expansion, it's billions of dollars, and you've got a healthier workforce. It's cheaper to get someone coverage early, let a woman go and get a mammogram early before cancer is detected. We spend so much more through emergency rooms later, and they get that. We get that at the state level.
So let's talk about the mental health piece of this. What has the ACA done for mental health care coverage in a place like Virginia?
Well, it's very sad in Virginia. I've worked very hard to expand Medicaid. We have not done it. For those Virginia residents here today, we have forfeited $10.5 billion. B, I lose $2.4 billion a year, $6.6 million a day. I come from a business background. I've started dozens of companies. The idea that the federal government will give you back 100% of the money, I can cover 400,000 Virginians. I've paid for these people to get health care, and we're not giving to them. And yet these people are still going to emergency rooms, folks. Who do you think's paying for it? We are. We've paid twice. So we haven't, and it has cost me $2.4 billion a year. About $300 million of that would directly go to help me deal with the mental health crisis I have in Virginia. $300 million. So because of that, I've had to take executive action as governor. And in fairness, I worked very closely with my legislature. You know, we always had a patchwork quilt of, we offered services here, Roanoke may offer something, Virginia Beach doesn't offer. So finally, I went with comprehensive mental health reform. I got it passed last year. We put $35 million up directly. We have 40 community service boards in Virginia today. Now, under law, same-day access. In the past, honestly, Reed, you'd go in, if they were full, come back tomorrow. Make an appointment 2-3 weeks. And, you know, many times that didn't happen with very catastrophic results at the end of the day. So today, we now have same-day service. You have to get seen when you come in. And I put another $7.5 million just to deal with that problem, but $35 million overall. We have 11 state hospitals, mental health hospitals. We have 1,500 beds in Virginia today, and they're near capacity every day. We could use more. I could use the $300 million for more wraparound services for mental health. So unfortunately, I've done the best I can as governor to do state money, but I'm forfeiting $300 million. It makes absolutely no sense that we are forfeiting this money.
You mentioned that you're close to capacity already. Talk about that capacity challenge. How do you find the new facilities? How do you pay for them? How does that work?
Well, and listen, it's a combination of federal, state, and local. National Association of Mental Illness, NAMI, is very helpful to us, provides us with a lot of money. The Virginia Family Network in Virginia helps us tremendously. So we bring a whole coalition of different services available. And then, of course, there's private. Obviously, private services are available. From the state side, we watch this very closely. We had a catastrophe, as you all know, in Virginia. Senator Creed Deeds, just tragic with his son, who went to a community service board and there was no bed available. Unfortunately, as we found out later, there was a bed available, but the individual at the CSB, you know, was late on a Friday or whatever and didn't make the necessary calls, and we all know the tragic attacked his father and then killed himself, and it was just tragic. Never should have occurred, but because of that, unfortunately, that horrible incident finally got my legislature to understand that we have to do something. This is a real crisis that exists, and that's why I was able to get all these reforms passed. I just got some new landmark legislation, which I've been trying to get for 3 years in Virginia. We just got it done. You know, we are putting too many people in jail today that should not be in jail. They should be getting mental health treatment. They should not be in a jail. I still have many today. But now when you go into a jail in Virginia, you get screened immediately the day you arrive. We had a horrible instance a couple years ago. J. Michael Mitchell never should have been in a jail, stole candy and a soda pop, you know, $3 worth of food, was put in one of our jails, and literally, you're not going to believe it, literally starved to death in a jail. He never should have been there. He should have been, you know, in one of our state hospitals, should have had services. So we've just passed that. So we've had some obviously horrible instances in Virginia. The good news sitting here today is we've corrected it. Now, I could use a lot more money, more preventive care, and a lot more wraparound services. I need the federal money to do it. And I'm wondering, sitting here today, now my legislature, and this started to evolve over the last month. You know, I'm the most conservative talk show host in Virginia. I went on his radio show the other day, and his nickname, he said, I'm calling you Terry McGenius. I started laughing. I said, now why is that? He said, I apologize. He said, I fought you for 3 years on expansion. I was wrong, you were right. And to have, the most conservative talk show host, and I think our legislators, who, let's be clear, the only reason they won't take it is they're terrified of the Tea Party. They're afraid of a Tea Party primary, and they're going to lose. Plain and simple. You can call it anything you want. There were no excuses left. They said, oh, if we bring this money back, it'll bankrupt the state. I'd worked out a waiver with Sylvia Matthews when she was the secretary before, that we could bring this money back, and when it comes off the 100%, ultimately goes down to 90, that my hospitals had agreed to pay that difference. It's worth it to them. Put up $1 and get $9 back. And I told my legislature, stop all the talk. Send me a bill that says no state dollars can ever be used for the program. No argument left, but of course they would never send me the bill. I'm just wondering now that we know that Obamacare is now here to stay forever. It's not going away. I mean, it'll be reformed as it should be, and cost savings on generic drugs and other things. But now that you know it's here, can we continue in Virginia to forfeit $2.4 billion a year? I assume that my legislature is going to realize what a horrible position this has put us in.
You mentioned jails, and the prisons and jails frequently become, are almost entirely the largest mental health care providers in any given state. Yep. What kinds of diversion programs can a state like Virginia create to make sure that's not the case? Yeah, well, the first thing is, I say, I've just put this new money up. So it's training for everybody who works in the jails and the prisons. We need, right now, or before we pass our legislation, the folks who worked in our jails, they had no experience and no training in dealing with individuals with mental health issues. None. Now, every jail in Virginia, we have training. There will be somebody permanently always there in our jails to deal with someone who has a mental illness. But for me, the most important thing is, as you say, they're the biggest provider because, police pick up someone on the street. They're not equipped to deal with this. They take them to jail. They're not equipped to deal with it. We've got to, at that point, the diversion is they shouldn't be going to the jail. They should be getting treatment at one of our facilities. So we've really worked, and I established a task force 2 years ago and brought everybody in, from law enforcement to the people who run our jails to all the healthcare providers, to come up with a comprehensive plan in Virginia to deal with those individuals who are they shouldn't be in the legal system at all. That's not where they belong. We need to deal with what their problems are and issues that they have here and treat them. My goal is to keep everybody healthy. And so the biggest diversion plan we have now is if there's someone with a mental illness, you're not going to a jail anymore in Virginia. And putting them in a cell and just leaving them there with no treatment. So I'm very proud we were able to get that done. So we made a lot of progress in the last couple of years from where we started. Got a long way to go. As I say, I'm at 1,500 beds. I'm generally mostly at capacity. If we have to use other facilities, we will do it. We manage this very carefully. But Reed, never again will someone come into one of our CSBs, our 40 CSBs, and be turned away. Will not happen. And we've passed legislation to that effect. One of the other elements of this is the growing opioid crisis and the epidemic that's sweeping through a lot of places, including Appalachia. Southwest Virginia has been especially hard hit. What is the addiction piece of this? How does Virginia tackle addiction?
And let me be honest, all 50 governors are dealing with this. This is a crisis. For us in Virginia, it's a real crisis. You can take the state of Virginia, it looks like a shoe, cut it right in half, right down the middle of the state, and take the western part of our state out here, heading out toward coal country. That is all opiate prescription drug issues. Literally going to the east over to Hampton Roads, this is all heroin and fentanyl over here. We are dealing with two very distinct problems. It's interesting. Cut it state right in half and look at that. So we've passed a lot of legislation on this. Number one, over here, doctors are prescribing way too many painkillers. They are just plain prescribing too many drugs. Doctors need to be held accountable. So we passed a PMP. Right now, if you issue an opiate as a doctor prescribe an opiate, you can not issue one for longer than 10 days. Even at the 10 days, you have to do a risk assessment, which you have to send in to us. Then after that, if you are going to continue to prescribe, you have to send the risk assessment. You have to, register all the drugs you're prescribing. You as a doctor now have to go on our PMP so that you can see the folks who are doctor shopping out there. And if you are, you get a letter sent to the state and we'll take your license away. We have gotten very, very serious about this. And the other part of the state, you know, this fentanyl, I mean, out of China, synthetic, highly addictive. It just grabs a hold of your brain. And it's very cheap. And, you know, and as I say, I'm working with Governor Hogan and Mayor Bowles here regionally because, you know, there are no lines when it comes to these issues. In the same issue, you know, we need more drug courts. Putting someone in prison today who has a substance abuse problem is the worst thing you can possibly do. Just deal with it from an economics piece. It is going to cost the state a lot more money. So, you know, for all my, you know, sometimes I have to deal with my Tea Party, you know, they all talk about costs and all that. You're actually spending more money. Drug courts over here, keep them out of the justice system, get them the treatment that they need, get them healthy as soon as you possibly can. And so it all takes money. Unfortunately, Medicaid expansion would have a lot of money in it to deal with this opiate crisis. I have now had to put up a lot of state money because I don't have the availability of the federal money through the Medicaid expansion. So we have put up more money for the drug courts and the screening and the training for the people who deal with it. But it's, you know, I'm losing thousands of Virginians a year. You know, every Friday I get a report from every one of my agencies and my secretariats, and my Secretary of Public Safety, Brian Moran. His report always lists in the page of, it lists the name, age, whatever it may be, let it be opiate or death, injury. It now goes page after page. This is weekly. And it's a real crisis. You know, you got to do your best to try and keep these drugs out of your state. You know, very hard, as you know. But the one thing we can do as leaders is to make sure that we're identifying the problem, dealing with those issues, and keeping them out of the criminal system and getting them over here for substance abuse treatment and getting them healthy as soon as we possibly can.
So if you're wrapping all of this together, whether it's mental health treatment or addiction treatment, and you get to write the fixes to the ACA and present them to Congress itself, what does your proposal look like?
Well, what they need to do is the ACA, those three key areas, keep the individual mandate because, you know, you need the healthy folks in the system. And that's where President Trump and all the rhetoric that was coming out, they were doing nothing but destroying, no matter if we were going to repeal or not repeal, they were destroying health care because they were putting so much uncertainty and instability in the market. If you were going to get rid of the individual mandate and the healthy people are not coming in the system and you're only left with very sick individuals, what do you think is going to happen to healthcare costs? So putting all those, melding those all in together, and then, of course, for the individuals to make sure the subsidies are there. You got to make sure for the plans, the cost reduction strategies are still in place, and then the reinsurance is critical for it. Assuming that's all done, then we need to work on number two, we need to work on the cost savings, give us more flexibility at the states. Every state's different, but all 50 of us have some very good cost savings that we do in our states. My populace is different than other states. My needs and concerns are different in our states. Give us that flexibility to save money. Incentivize us to save money. I've always said the Senate ought to be doing it. But a tremendous, literally billions could be saved on dealing with the generic drugs on the Medicare program, which will then, you can use that money for the Medicaid program. On the Medicare, as I say, once you get out of the hospital, the billions we could save by doing, you know, one wraparound bundled services and let the healthcare providers save in those cost savings, billions could be saved. I could sit here and name you 20 different practical things, but, you know, it was hard when the Senate wouldn't even talk to us. I'd always argued with the Senate, they should have done regular order, they should have had a bill, they should have had hearings, they should have had witnesses, and they should have had amendments. That's how you make a bill better. Historically, that's how we've done it. But to do it the way they did it in secret, not reaching out to any of us governors who run the programs, just didn't make a lot of sense to us. But we need to commit billions, and they put up $46 billion to deal with the opiate crisis. That's a drop in the bucket. I mean, we need in excess of $150 billion to deal with all these issues and what we need to do. But I go back to the point. You spend money early, smartly, it will save you money in the long run. If I can get someone into treatment, you know, get them through the drug courts and deal with that and get them into treatment and get them healthy, that is going to save me so much. Just think of what happens as you go through the process if this continues to go on, that individual, all the issues that come with that, if they continue with substance abuse, may have criminal activity, have safety issues, and it's going to end up costing your state and the federal government a lot more money.
Mm-hmm. You've taken some criticism for your decision not to commute the sentence of William Morva. Mm-hmm. Walk us through that,
Sure.
your decision-making process.
Hey, listen, when I ran for governor, I personally do not support the death penalty, but, I took the oath of office as, I got to uphold the laws of the Commonwealth. I have done several executions. I commuted an individual several months ago because the jury instructions were just dead wrong by the prosecutor. Actually, something had been made up and said to the jury that he had been involved in another murder, which he had not been. So I commuted that sentence to life. This one, Mr. Morvo, I spent a lot of time on this. This is the hardest decision you make as a governor. I didn't sleep a night before it. I mean, I read thousands of pages, had my team in. Mr. Morvo, as you know, it was a horrible crime. He very calculated escape. Pretended he had a broken arm, had them take him to the hospital, couldn't handcuff him because of a broken arm. None of that was true, and ended up going in the bathroom and taking out the towel bar and then literally beating a man's face, shattering his face, took his gun, walked out to the lobby to leave the hospital, and there was a security guard there, put his hands up, said, I'm unarmed, went right up to his head, shot him in the forehead. The next day, they were looking for him down by Virginia Tech, out in the woods, and walked up behind a sheriff in the back of his head and killed him. So, some heinous crimes. The issue was there an issue of mental illness? At the trial, this was debated. 3 experts were brought in. All 3 said he had the mental capability to know what he was doing. What was interesting is 2 of the 3 witnesses, expert witnesses, were his witnesses, his experts, including the one gentleman who has written the textbook on this from the University of Virginia, the expert on mental illness, and they all said he had the full capabilities. So this was debated. What happened is 7 years later, one individual came out and said that, no, he didn't have the capability 7 years later. But as a governor, I got to look at the case file in front of me. I can't overturn a jury and a judge who had the facts in front of them who determined, just because I don't like the sentence, that's not the authority I have as governor. I got to uphold the law. And at the trial, as I say, this was debated, and 3 of the expert witnesses clearly said he had the mental capabilities to understand when he killed those, brutally injured one individual and brutally killed 2 others, that he fully had the capability to do it.
Gotcha. We're going to have a few questions from the audience in just a minute, but first I want to get to at least a little bit of politics. Congressman Joe Crowley said yesterday that the Democrats are still trying to craft their message for 2018. What should that message be?
I get asked this a lot. The message is not that complicated. What people want from their elected official, number one, are results. If you look in Virginia today, I know we have some Virginians here, 66% of the state believe the state's heading in the right direction. Those same folks think that 2/3 think the country's heading in the wrong direction. We have results in Virginia. I can just tell you unemployment's gone from 5.4 to 3.8, record investments in education, transportation, mental health, juvenile justice reform. I'm a socially progressive, I'm a fiscally conservative, socially progressive governor. My whole emphasis as governor has been about jobs. We've shattered every economic development record in Virginia history. Billions of new capital investment. I'm the most traveled governor in America, 29 trade missions. What's the message? I can only speak to Virginia. Every state's different. The message is we're working together, and we worked in a bipartisan way. I have a very Republican legislature. I have 66 out of 100 Republicans in my House of Delegates, 21-19 in the Senate. We work together in a bipartisan way on economic development, on transportation, on a record education investment, on mental health reform. We got together and worked things out. Now, I disagree greatly with my General Assembly on social issues. I own the record. I have vetoed more legislation than any governor in Virginia history, 120, but I'm 120-0. I was never overridden once. But, horrible legislation, anti-women. I told women in Virginia when I ran for governor, I will be a brick wall to protect women's rights. When I became governor, they were shutting all of our women's health clinics down, every one of them. I stopped that. They're not closing. Horrible, we had an HB2 bill, horrible anti-LGBT. I've stopped all of that. I've leaned in on the environment issues. I have climate change an issue. As you know, I took executive authority before Trump pulled out of Paris to do our own carbon dioxide emission reduction. We have to. Hampton Roads is the second most vulnerable region in America. I got the largest naval base in the world in Hampton Roads. So, and I've stopped horrible trying to get more guns. I just vetoed a bill where they sent me a bill you could sell machine guns out of gun stores. I mean, come on. And roll back a voting right. So the Democratic message ought to be is, you know, economic prosperity for families and at the same time socially progressive, giving people individual freedoms. You cannot grow an economy if you're putting walls up.
Gotcha.
But every state's different. You know, people say, who's the leader? I think the leader of our party today are the grassroots activists. I give them tremendous credit for what happened on health care. Forget everybody else. It was those grassroots activists who did the town halls, who showed up at the Senate yesterday. The passion of the grassroots activists, they're the leaders of our party, if you ask me.
Gotcha. I think we got time for one or two questions. Anybody in the audience? Right over here. Up. Okay. This young lady's next.
Cool.
Go ahead.
Hi. Ed Gillespie and Ralph Northam were recently selected as the candidates for the gubernatorial election. Have you had the chance to speak with either of them regarding their plans for mental health care?
Plans as relates to?
As it relates to if they are elected, how they plan to continue some of the work that you've done or work with the legislature to ensure access?
Well, Ralph, I talked to a lot. He's my lieutenant governor, and I have been very active supporting him. You know, as I say, you can go through all the great success Virginia is a new state than we were 3.5 years ago. As I say, 3.5 years ago, we had the horrible TRAP laws to shut our women's clinic down. They just had the horrible debate on the transvaginal procedure in Virginia. I can go through chapter and verse. That's all gone. That's all behind us. And all this economic development accomplishments we've had, Ralph was at my side. So election night, Ralph was asked, do you plan to continue the policies of Governor Terry McAuliffe? And said, you bet I will. I mean, he and I and Mark Herring, who's the Attorney General, I mean, this has been a battle on a lot of issues. You know, I've been sued a bunch of times. I'm proud to sit here that I've restored more felon rights than any governor in the history of the United States of America. I'm very proud. People deserve second chances. But as you know, I was sued twice, and they took me to the Supreme Court. I was sued for contempt of court. That didn't matter to me. What mattered is I was helping these individuals out there. And Ralph and Mark Herring had to defend me as the Attorney General. So we have been a team. I don't know what Ed Gillespie is going to run on. As I say, when I took office, unemployment was 5.4. Today it's 3.8, lowest in 9 years. Our unemployment claims just hit a 44-year low. $16.5 billion of new capital, the most any administration had done was 13 before I came in. So I don't know, we can't run on the economy. We've protected women's rights and social rights. I doubt he's going to go the other way. And Donald Trump today is probably at 36% in Virginia. I just think it's going to be very hard. I think it's going to be a banner year for the Democrats. We have our entire House of Delegates up 100 seats. There are 17 districts that Hillary Clinton carried that Republicans now hold the seat. We have a record amount of women running like we have never seen before in Virginia history. So we're going to have a big election this November. And listen, the state, we're on a roll. But we just got to keep that going. We cannot take our foot off the gas. We just got to continue to do it. And we have got to be a brick wall to make sure that people understand that Virginia is open and welcoming. I live, eat, and breathe economic development because to me, without a job, none of this other stuff matters. There's no income for me to invest. I put $1 billion in education last year, the largest in Virginia history, to redo K through 12. High schools don't work in America anymore. They don't. They're big buildings with classroom with seats, and you get credit for seat time. That was the Industrial Revolution. That's not a 21st century economy. We now need credentialing, workforce development. I have in Virginia today 36,000 open jobs in cyber. Starting pay, parents, is $88,000. You don't need a 4-year degree, 2-year degree. My problem in Virginia today is I have too many high-paying jobs that we're not filling. That's why I'm restructuring our whole K through 12. This fall, you go to school in Virginia, K through 5, we're teaching you cyber security starting in kindergarten. It's a new economy, and we got to get, I mean, you're all too young, but there used to be a movie called The Graduate, and the key phrase was plastics. I'm telling you, it's now cyber. Virginia now, #1 state in America for cyber companies. #1 state in America for data centers. #1 state in America today for UAVs. In fact, 2 weeks ago, I was the first governor to fly an unmanned aerial vehicle. Went up on a plane with a little robot flying it, and I had a little keypad. Boom, boom, boom. Went 8 miles out over the ocean. I hit takeoff. I hit land. It landed. It came right around and literally landed on an X. It was happy. I just jumped out of a plane the other day, 10,000 feet, parachuted into a Wounded Warrior clinic of that concert. My security guys don't even care what I do anymore. He's only got 6 months left. Let him do it all. Never could have done it 2 years ago. But Ralph will be a great continuation. He's a medical doctor, and you want to talk healthcare, he knows these issues inside and out. You know, served in the military, lieutenant governor, state senator. He's great.
All right, I'm sorry to do this, but we've run out of time with Governor McAuliffe. But hey, Governor, thank you so much for taking the time.
All right, thank you, everybody. Thank you, buddy. All right, thank you. Great.